Good evening, everyone. This is Ryan Hoyme, aka Massage Trainer, and tonight we have a special guest, Ben Benjamin. So, on Ben Benjamin, I'll give you a little bio.
Ben E. Benjamin, PhD, holds a doctorate in education and sports medicine, and was the founder of Muscular Therapy Institute. Dr. Benjamin has been in private practice for more than 45 years, and has taught extensively across the country on topics including orthopedic massage, active isolated stretching, and ethics. He is the author of Listen to Your Pain, Are You Tense? And Exercise Without Injury, and co-author of Ethics of Touch. He offers continuing education for massage therapists around the world via webinars and online courses.
Welcome tonight, Ben.
Thank you.
Yeah. So, the question is, you've been in the field for quite a while now, so what got you started in this field?
Well, I think a lot of people get started because they have a problem. And I had a problem, and my problem was that I had a back pain when I was very young, about 13 or 14 years old. I had very severe back pain and struggled with it for a while, and then found somebody, a phenomenal therapist with his hands named Dr. Kagan. People called him Dr. Kagan because he helped so many thousands of people. He was a French man who did deep massage and had tremendous knowledge of the body, really an intuitive therapist. And he helped me for many, many years, and he trained me sort of as an apprentice, and I worked for him, and that was really my beginnings into the field.
And then you're also a PhD in education and also sports medicine then?
Yes.
Okay.
In the late 70s, I got my PhD, and I was wanting to build on what I already knew. So I got my PhD in sports medicine and education and worked with Dr. James Syriacs, who's a brilliant orthopedic physician. He really coined the term orthopedic medicine as opposed to orthopedic surgery. And I worked with him, studied with him in Rochester, took his course 3 times, and really learned a tremendous amount that I had no idea even existed, that you could actually assess somebody's injury within like a quarter inch of space and see what was really causing their pain and could figure out how to really help them. So that really started me on a new path, and it was very exciting. And I got my PhD doing it, so it was great.
Yeah, he's definitely an icon in the field too, just like yourself too. So, yeah. And for the low back injuries, what would you say the most common low back injuries are?
Well, there are many theories, of course, and in my experience, the most common denominator of low back pain is really the sacroiliac region. There are multiple layers of ligaments in that region. You have your superficial sacroiliac ligaments, you have the middle layer, the deep layer, and then you have all sorts of other ligaments, the iliolumbar ligaments, the sacrotuberous ligaments, lots of different places that you could strain and hurt yourself. So I think this complex of ligaments, with the sacroiliac ligaments being at the center of it, I think causes the majority of back pain. I don't mean the pain that you get one day and then it's gone the next day. I mean a pain that comes and stays for weeks or months or years, or keeps recurring over and over and over again. That's usually a ligamentous issue.
And with that, are there a lot of different modalities that people will use to try to treat that?
Oh, people use, I would say, when I stopped counting, there was 200 different bodywork and all sorts of modalities to treat people. I found a few that I think really work. I think a lot of other things sometimes work because it would have worked anyway. You know, I have this saying that if you get better in 6 months, you could have locked the person in the closet and they probably would have got better in 6 months. Now, I wouldn't lock them in the closet, but I mean that it wasn't the treatment. If you do a treatment that works, people feel better much more quickly, usually within a few weeks or a month, and there's a really direct correlation. So when I'm seeing somebody who has a low back pain, the first thing I'm going to do is I'm going to do a very thorough assessment. So I see exactly what is it that's causing that back pain. Is it the ligaments? Is it a muscle? Is there alignment concerns that are causing the ligaments to strain? Is it a disc pressing on a nerve? You know, what's really going on? And if you have that information, you can be a lot more successful going forward because you know what you're doing. So for instance, if it's the iliolumbar ligament and you have pain on one side and you treat the sacroiliac ligament, not going to get better. if they have a pain going down the back of the leg, and it's this sacrotuberous ligament, and if you're treating the sacroiliac ligament, not going to work. So you've got to match the treatment to the person and what is actually torn or damaged or injured in their body to help them get better. The real secret to all this is that there's scar tissue that formulates. Once you tear a fiber of ligament, muscle, anything, and it heals back together, if it doesn't heal like this, like with the ends of the fibers together, it all heals in a sort of a messy kind of thing, like if you drop some thread and put some glue on it, everything's crisscrossed. And then every time you do a movement, you tear it again, and so you keep inflaming the tissue. And that's what happens with people's backs and necks and various parts of their body. So you've got to isolate exactly where the adhesive scar tissue is. You've got to break it up and then have the person healing in the presence of movement so they don't form more scarring while they're healing by staying still. And then they're going to get well and stay well.
And is there a difference in the texture for like lower back scar tissue compared to scar tissue other areas of the body, would you say?
Well, in gross cases, you can really feel the scar tissue with your hands. But in most cases, now the sacroiliac ligaments, they're in there a bit. And you're not going to feel the scar tissue. It's going to be microscopic. Now you might feel, if you were working on a myofascial layer, you might feel some stickiness or some resistance. But with the ligaments and the scar tissue, you need a microscope. You need to open the person up, and you're not going to do that. That would be kind of messy and really not great. You really have to know that the scar tissue is there. You have to know how to find it. And when you press on an area where there's scar tissue, it hurts a lot. Even if you press very gently, you can feel where the pain is, and those are the areas that you work in.
Okay, and then for lower back, I mean, sometimes with like myoostosophistications and different kind of problems down there, how can you differentiate between those?
Well, when I train people to do a back assessment, there are 26 tests that you do. Some of them are tests where there is movement, some with resistance, some for the nerves, some for the joint, etc. So you have to isolate exactly, at least that's the way I was taught, what I've learned in my years, that you do a full assessment. I do a history of the back for maybe 20 minutes, and then I'll do a full assessment. I'll spend the entire time with somebody just doing an assessment. And then I'm going to do some palpation to really fine-tune, where is this injury? Is it in the supraspinous ligaments? Is it in the sacroiliac? Was it on the right? Is it on the left? Where is it? How severe is it? Part of how severe it is how far it travels down the body. If you refer pain all the way down to the foot, it's more severe than it just refers pain to the buttock. And I don't think there are actually a huge number of causes of most people's back pain. Most people's back pain, I think, is ligamentous when it lasts for a long time. The gluteus medius is usually involved. There's usually scarring there, and it's usually a number of the ligaments. In maybe 3 to 5% of the cases, it's a compression of a nerve by a disc. At least that's the information that I have from the physicians that I work with, that really disc problems are much rarer than we think they are. And I've had the experience of working with people's ligaments and having them get better for many, 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 many years. And I've had the experience of having people do all sorts of treatments and not get better until they found the right treatment. Now, if I have somebody and I can't get them better, maybe because the injury is deeper inside the body than I can touch. For instance, if it's the middle layer of the sacroiliac ligaments or the deeper interspinous ligaments between the L4 and L5, you can't do it with hands-on work. It's got to be done with something else, like an injection. And I work with physicians where I would take the person down to see a doctor, and I would actually watch them get injected, watch them get treated, and sometimes within minutes, because they use xylocaine when they do the injection. And that numbs it, so you know if you've hit the right place. I've seen people get off the table who couldn't even bend over to touch their knees, put their palms on the floor for the first time in several years.
Wow.
and so I've had experiences that have proven to me it's not a million different things that go wrong with the back most of the time. Now, there are lots of things that can go wrong with the back, and there are probably 20, 30 different reasons, but I would say 80 to 90% of the time it's going to be one or several of the ligaments in the low back that's causing pain that's chronic, that lasts for a long, long time. Now, that's the direct cause of pain. Let me take a second and talk about the other part of it, and that's what I call the indirect cause of the pain. So if you're hurting, it means something's torn or pinched or inflamed or swollen. If you, for instance, if your alignment is poor, and you have a pelvis that's swung forward, the front of it swung forward, you have a compression, or you're standing on one leg, or your hip is rotated forward. Now that's a condition that is what I call an indirect cause. So it sets your body up so that you're going to strain your ligaments, your muscles, everything. And once you've done that, though, if you just correct the alignment, it's not going to fly. You're not going to get better unless something gets rid of that scar tissue that's in your body. So I prefer to know what's going on and the direct cause, and I like to know what's the indirect cause. And their indirect cause might be the kind of work they do. They're a dentist. They're bending over all the time. They never exercise. So I'll get them to work with the trainer and exercise their body so they're going to go in the opposite direction. Instead of hunching forward all the time, they're going to use those other muscles to balance their body out. If they're eating poorly, I'll have them work with a nutritional counselor to teach them how to eat properly, because your whole body's health is based on what you put in it for food. If your stomach is not working well and you have intestinal difficulties, you're going to have referred tenseness in your muscles, which is another indirect cause of getting an injury, which might be a ligament or a muscle or the fascia or something that's actually causing your pain. So I differentiate indirect, the things that get you set up for your pain, and the actual pain cause at the moment is some kind of damage or lesion to a tissue.
Okay.
At least that's how I work with it.
Okay, awesome. And then somebody in the chat asks, is all scar tissue able to be broken up, would you say?
Maybe not all. If you had a really massive injury and you've been having it there for 30 years, maybe not. I've seen it done in several ways. I usually do it with my hands, and I've seen it done by very, very smart, very, very talented physicians who will take a needle and put in the needle and just break it up by injecting 2.5 inches inside the sacrum. If the adhesions are very deep, you're not going to get it with your hands, but you can get it with a needle with some xylocaine. So there are various ways to do it, but of course there are some that you're not going to be able to help, and that's a sad story. But most you can.
And what actually causes sciatic pain down the leg, would you say?
Well, the whole idea of the term sciatic pain or sciatica is that people think that it's the sciatic nerve that's being compressed by a disc that's causing the pain down the leg. Now, first of all, the sciatic nerve consists of 5 nerves bundled together. It's L4, L5, S1, S2, and S3. And you don't usually have a disc pressing on all of that. That's very, very, very uncommon, almost impossible. You'll have a disc pressing on one of the nerves, even 2, and that will cause a pain down the leg. However, a torn gluteus medius can cause a pain in the lower leg. A strain in the sacrotuberous ligament will cause a pain straight down the back of the hip, into the back of the thigh, into the back of the calf, and the heel. An iliolumbar ligament will cause a pain on the outside of the leg. And so you've got all these referred pain down the leg in different patterns that can be caused by the ligaments, the muscles, the fascia. So most of the cases of what we call sciatic pain are referred pain from soft tissue structures that are not nerves. Because most of the injuries, the pains that people have are not discs, according to neurosurgeons and orthopedists. So I say sciatica is just an expression of the referred pain that the person has. And it means that their pain is pretty severe, because the farther that the pain refers down toward your foot, usually the more severe it is. There are really 4 rules to referred pain. One is that it goes in the dermatome. Usually the dermatological way is when you're in an embryo state, your body's made up of 32 pieces. And then your body remembers those pieces as you grow. So, for instance, if you have a heart attack, you don't get a pain only in your chest. Sometimes you don't even get a pain in your chest. You get it down your left arm, because they're made of the same dermatome. And so the dermatomes in the back, go all the way down the leg into the feet. And so that's one rule. Another one is that referred pain, when it's in orthopedic medicine, doesn't cross the midline. If you've got a ligament problem on your right, it's on your right. You got it on the left, it stays on the left. If you've got it down both legs, it means it's not a disc. It means you got ligament injuries on both sides, referring pain down both legs. So that's doesn't cross the midline, in the dermatomes, And it also, another rule of referred pain is that it refers farther if it's more severe. So it's proportional to the severity of the injury. And those are some of the rules of referred pain. And so sciatica is an expression of an injury to something. You don't know what. Could be 10 different things going down your leg. Nerve is only one possibility. Did that answer you?
Yeah, and do you think people just overuse that term a lot of times too?
Oh yeah, I think everybody calls everything sciatica, and they mean a pinched nerve in the back is causing it. And it's just a kind of a shorthand for people who don't have the information of what is really going on here. It's a referred pain down the leg, and that's all sciatica means. It's pain down the leg. That's it.
And then also, I've heard the term Piriformis syndrome. Is that used much at all?
Well, I don't use it because I don't see it very often. When somebody comes to me and they have a so-called piriformis syndrome, I find that it's usually something else. It's either a gluteus medius strain, or it's usually it's a sacrotuberous ligament strain, which is kind of close by to where the piriformis is. And remember, this is all referred pain, so it's not exactly where you think it is. You have to be able to isolate where the structure is that's giving you the injury. And some people believe that that's very prevalent. The doctors that I work with don't think it is, and I haven't seen it hardly ever, and when I have, it's been something else. So if somebody really brings me somebody who's got that and can show it to me and can do a test that shows pain when I do a resisted action for the piriformis, then I'll believe it.
Okay. And then how frequently do you actually treat somebody with low back pain, would you say?
Well, I'd say ideally it would be 2 or 3 times a week. It depends on the severity. It depends on what's happening with their body. I would often combine the treatment with active isolated stretching and strengthening. So I would do a couple of sessions of friction therapy combined with a little bit of active isolated stretching. Then I might do one whole session of active isolated stretching so that I would get the person mobile again. You want to heal in the presence of a full range of motion. And that's a really important sentence. That's an incredibly important concept. Because if you don't heal with a full range of motion, you're going to get your problem back again. And if you didn't have a full range of motion before, that's probably part of the reason, that indirect cause thing, lack of flexibility of your hamstrings, your quadriceps, your back, and that sets you up for all sorts of injuries in the low back.
And I know a lot of personal trainers will say you have to build up your abdominals, strengthen your abdominals, and it'll help your lower back pains. Is that necessarily true in some points of it, or?
I'd say that's partly true. I'd say that's a limited view. I'd say you have to build up everything. You have to build up your abdominal muscles, your core, your back, your gluteal muscles, your thighs, your legs, your flexibility in addition to your strength. So for instance, if you can do maybe 12 squats holding a 45-pound weight in front of your chest, your legs are getting pretty strong. You want to be able to do lunges. You want to be able to do rotations with weight. You want to be able to, do pull-ups, push-ups. You want to be able to use your arms, your legs. You want to have good flexibility. You want to be able to touch the floor with your hands, at least with your fingertips, if not your palms. You want to have flexibility and strength and balance in your body to prevent injury. Not just, if you just had a strong abdomen, I'd say forget it. You want everything to be strong. You want everything to be reasonably flexible in order to maintain the health of your body and not get a low back pain again, ever.
And do you think the psoas major is contributes to some of it sometimes too, or?
Oh, absolutely. The psoas is a really important and very unusual muscle. Different parts of it create different types of movement. It moves the pelvis actually in both directions depending on which of the iliopsoas muscles are involved. The iliacus and psoas work hand in hand together. So for instance, if you have a constriction on one side of your psoas muscle, your leg, let's say it's on the right side, your leg will be pulled up into your body. And so then when you walk, you might have a half inch leg length difference, and you're kind of hobbling along. You're kind of like going like this. And that puts a strain on both sides of your back. And so I measure that as part of the assessment. Is one of the legs functionally longer than the other? Not, structurally that's different. You had a surgery, you broke your leg, or you has some kind of bone abnormality. That's not the same. I'm talking about when the psoas contracts and constricts, it just pulls that leg up, just pulls it up like my shoulder is, and you're having a leg length imbalance. So if you work on the psoas, and we covered this in my webinar, and I have little video clips on it so that people can learn to do it. It's not very difficult to do, and you straighten out that leg length, and I think that has a lot to do with low back pain, because if you have that tilt there, you're going to make your sacrum be lopsided, and you're going to bang on it, and it's not very good for the sacrum. And then you get tears in the sacrum, spasms in the muscles that are trying to protect that sacrum after you've got some of those tears, and you get yourself into trouble. So I say get your psoas relaxed, flexible, balanced. I don't think having an injury in the psoas is what causes people to have pain in their back. Matter of fact, I had a client once when I was working in a medical office a number of years ago, and this is a fellow who came around from Europe, and he was a soccer coach. And he came in, he had spent $10,000 on all these tests at some local hospital because he had pain deep in his abdomen and a little bit of pain in his back, but more sort of in his abdomen, I think it was the left side. And so I was working with a physician friend of mine in his office, working, and had a couple therapists under me. And he said, well, let's have Ben take a look at this person before we go through another battery of tests. It seems crazy. So I took a look at him, and what he had was something unusual. He had an actual strain of the psoas muscle and the tendon attachment to the spine. And so he needed some friction work done in both of those places. And so we worked on him for, I don't know, 4 or 5 weeks, completely better. And he had this for 8 months or so. And it was not anything internal. It was just his psoas muscle. And it's a very simple couple of tests you do to figure that out. But nobody ever did. Nobody ever touched him. No one ever did those physical tests to test the psoas. And what you do to test the psoas is you have the person lying down on their back. They bend the knee so that the hip is, it's just beyond the hip, so it's bent at 95 degrees. They bring their knee toward their head, and you resist it. And then there's pain.
Okay.
And if there's pain during that in the abdomen, that's what you got.
Okay. And then would you say exercise is a big important part of the treatment too?
Absolutely.
Yeah.
So I'll treat somebody, and as soon as they're able to exercise, I'm going to have them do a range of motion things first. I'll have them sitting in a chair, and I'll have them bending forward, putting their hands way under the chair. I'll have them do special other exercises with one leg higher than the other, up on a stool or something to get the iliolumbar. And I'll have them do rotation. So that's first to get the general flexibility. Then I'll do some AIS on them to get some, that's active isolated stretching, to get more flexibility in the hamstrings and the quadriceps and the adductors and abductors if they need that. If they don't need it, we skip it. And maybe they just have hamstrings or just have adductors that are tight. And then we start a strength program. We go downstairs to my little gym in my office, and we start using kettlebells. We start having them do squats. We have them do weighted squats, work with a bar, so that they really strengthen their body in good alignment, so that everything is flexible, everything is strong. And then it's a lifelong thing. You can't just exercise a little bit. People go out and run on the weekends or play soccer on the weekends. They're going to kill themselves. You got to exercise 3 times a week, at least twice a week, but 3 times a week is better, doing strength and flexibility, alternating your upper body, your lower body, getting everything, your arms, your fingers, your toes, your back, your neck, everything flexible, everything strong. So I think that's a vital, important thing. I think actually every massage therapist should have a certification in personal training. And we're going to be doing some different series on fitness, and I've written several articles on it. And I think it's a very important thing to have that knowledge to really help your clients. Because just getting relaxed or just getting over an injury, that's just the first step. You want the person to stay well, they've got to do something more.
Okay. And then what about the position people sleep in at night? Does that affect, would you say?
Well, if you're hurting, there's a lot of positions you can't get in. The one position I would warn against is sleeping on your abdomen. Because when you're on your abdomen and your body kind of bows, down, you're going into extension. So it's like you're doing a back bend like this, while you're sleeping. Now, you don't want to be doing a back bend while you're sleeping, because that's going to crunch your back. So, and if you have to sleep on your abdomen for some reason, you put a big pillow under your abdomen so that it can create some alignment. The best way to sleep is on your back with a pillow under your knees, if you can sleep that way. A lot of people can't sleep that way, so the next best is to be on your side, to have a pillow under your head so that your head and neck are in alignment with the rest of your body, and your legs can be curled up or one bent, one straight, whatever, but some position that you're really comfortable in. But if you can sleep on your back, I'd say that's the best for your back. And with a few sleepless nights, you can usually train yourself to sleep on your back.
And what about the cervical pillows too? Are those beneficial?
Those are beneficial if you've got the right size. They come in small, medium, and large, and sometimes even they don't fit. I use one that's medium. It's not quite right for me, so I put a thin pillow over it. So that's just perfect for me to lie down. So it just depends on your body, and it depends on what you're comfortable with. The most important thing is to be really comfortable. I mean, a lot of times people move a lot in their sleep. They did some sleep studies and showed that people move 200 times on average in the night. So sometimes you can't control it. But those who have a lot of back pain and train themselves to sleep on their back do a lot better.
And what about the body pillows, the really long ones and stuff? Are those, if somebody's going to sleep on their side at all?
Yeah, those are really nice. I know that Oakworks makes one, and so the body cushion is another one, so that your body is really supported. If you're on your side, you're really comfortable and you feel good, and that works for you. I think that's an excellent option.
Okay. And then what are some of the best positions to ease low back pain, would you say?
Well, again, it depends. If you have a flexion pain, an extension pain, or a lateral pain. So what do I mean by that? Well, if you have an extension pain, that means if you bend back, it hurts. So you're going to want to limit your standing, and you're not going to want to lie on your stomach. Now, if you have a flexion pain, it means that your low back hurts you when you bend forward. It's one of the tests that we do, and we find that out immediately. So that means that sitting is going to bother you. It's not going to be great, and standing is going to be better for you. So, for instance, if you work in an office and you work on a computer, I suggest you get a standing desk. That's a desk that you can put your computer or your papers at a height that works for you while you're standing. So you can sit for a while, stand for a while. Now, if you can't do that, you set an alarm. You get up every 30, 40 minutes and you walk around for 5 minutes so that you are in the position that helps you. And if you have pain bending to the side, well, you have to be really careful about that, especially if you do kinds of work that make you bend over to the side. You need to limit that until you feel better. Does that answer you?
Yep. And then my daughter, a few years ago, they started having these bouncy balls to sit on for their chairs instead of regular chairs. It's like a exercise ball that's cut in half, basically, so it's harder to fall off of them and stuff. But is that beneficial to help with your core and stuff? And
those are great, and actually having the full ball is even better, because then you really have to balance yourself. There's a whole slew of exercises you can do for hours on various sized and diameter balls, huge ones and small ones, etc. And a guy named Paul Chek in California, who's a very profoundly advanced thinker in terms of exercise, he's sort of developed a whole system of Swiss ball exercises. You could just do exercises forever on a Swiss ball, and sitting on them just in your daily life is another good thing that strengthens your body, keeps your balance going, and it's good. And young kids don't want to sit still anyway. It allows you to bounce up and down and move, so they like that too.
yeah, and my daughter says every now and then some of the kids get their ball taken away from them because they bounce on it too much and stuff.
Yeah.
So.
It's kind of criminal that they teach kids to be in school and they have to sit all the time, because lots of people can't learn that way. There are different types of learners. There are visual learners. They can usually sit for a while. There are auditory learners and kinesthetic learners. And kinesthetic learners are the kids that people think are, bad kids or not good at school, because they can't sit still. Well, a lot of people are not meant to sit still. They like to move. The body doesn't really like to be stationary for hours and hours and hours. That's what's killing lots of people. It's kind of unhealthy to be in one position for a long time. You want to get up, you want to move, be in one position for a while, but not for hours and hours. I had somebody come in the other day, she said, I used to not practically get up for like 10 hours, work on the computer.
Oh.
I said, wow, that's a great way to hurt your back or your neck or your arms or everything. So.
Yep. And then some people will actually say my back is out. Is that one thing that actually is actually causing that, would you say then? Or?
Well, I asked them who it's going out with.
Okay.
Yeah, but it's a colloquial term that is used by the lay person because their back is not where it's supposed to be, and that's true. And so probably what happens is it goes really in a tiny bit out of alignment. But if your back goes a little bit out of alignment, for instance, and your pelvis rotates and your sacrum rotates a bit, you can be pulling on those ligaments so harshly that you have incredible pain that you got to lie on the floor and you can't even get up for 3 days. So, those subtle things can cause you pain that's coming from a tearing and shearing of the fascia, of the muscles, of the ligaments. So, when they say my back went out, basically they say, I'm in a lot of pain. Can you help me? And I say, yeah, well, let's figure out what's going on with you, and let's see who can help you, whether it's me or somebody else. Let's figure out what you need. And I had one woman come to me, and she'd heard about my work and whatever, and I looked at her, and she was a very delicate soul, and she had a very weak craniosacral rhythm. I mean, it was barely there. And she was very tense in her body. And I said, well, it wouldn't be good for you to work with me. I know what you've got, and this is what's happening, but working with me is not the right thing to do at the moment. So I suggested she work with a craniosacral osteopath that I know and work with, and she went and worked with him for a year. And I said, well, you come back when you feel like when he's kind of done with you. And it took him a year to get her body energy to move. And then she came to me, and she worked with me for about a year and a half, and we did all sorts of things to create a really healthy body that could then go and get pregnant, that could go and exercise. And she was not in very good shape when she started, but she ended up in great shape because she did a number of different kinds of things to get her body well in the order they needed to be done in. That included acupuncture, it included me, it included changing her diet, a lot of different things.
I wish I would see that a lot more out in the field where therapists would actually recommend to go to somebody else, another specialist. I mean, I don't hear of that much.
Well, people are on a sort of a poverty consciousness, or like they need the client for them, or it's the teenage years where you think what you do will fix everything. I know what I do doesn't fix everything. I know I have a piece of the puzzle, and I know so many things are important. For instance, if your diet is really poor, it's going to be really hard for you to stay well, even if I get you better. If you're not exercising and you don't know how to exercise, you're not going to stay well either. If you don't know how to warm up your body, even if you exercise, you don't know how to get your body ready for warming up, you're going to have a lot of trouble. If your energy is low, if your cranial rhythm is in poor shape, it's not going to work. Those are not things that I would necessarily do. I do exercise programs with people. I've been trained in that. I'm certified in that. But I also send people out to others. I had a guy come last week, and I'm one of the most expensive people in the universe here. And so I only work a limited amount of time because I like to do a lot of other things. I like to teach, and I'm writing a book and doing lots of things. So I sent him to somebody else who does a lot of work with exercise and active isolated stretching, who charge much less than I did, so something they could afford. So I refer people out all the time, even when it's not in my, even if I want to work with them. If I need the money, that's not a question. I don't ever make a decision based on that. I go and refer the person to where they really need to be to get well, and whether that's immediately or follow up, or I often start with people so that they get a kind of confidence in me and what I'm doing, and I help them some. And then I add one thing at a time. I say, and they ask me questions. Well, how can I stay well? Well, I say, if you're drinking 5 cups of coffee a day and you're having, sugar in your coffee and you have dessert 3 times a day, it's making it harder for your body to be well. So what about if we get you a nutritional analysis and we figure out how to get you well? And so then they get a whole nutritional analysis by somebody who really knows what they're doing, lays out exactly what's happening in their body nutritionally, and then they do that kind of work. So I can't do that, but I can lead them to that. I'm a good person to connect people with what they need, and can usually figure out when there's a certain kind of a problem. And I'm glad to do that. And then people get well without me, and that's just great.
Okay.
And then some of those people refer me people for the rest of their life, even if I didn't spend much time with them, because I'm not taking them into me thinking I'm the person who can help them. I'm saying, hey, what's the best thing for you? What do you need right now? Do you need some psychotherapy because you were traumatized? Do you need nutritional therapy because your body's depleted? Do you need an osteopath? Do you need myofascial work? What do you need? And that's what you should get.
Wow, that's awesome. And then for, let's say somebody has lordosis or somebody has more of a flatter back, is there different kind of back pains with those two then?
Well, if you have a lordosis, one of the things that's in danger is your supraspinous ligaments. Those are the ligaments that go between the vertebrae, between L3, L4, L4, L5, L5, S1. They're right on the surface. If anybody who's listening, just put your hand on your low back, anywhere in your low back, and just find your vertebra. Just feel your vertebrae. If you're on the vertebra, go to the next vertebra, okay? And in between that and on the vertebra, you're on the supraspinous ligaments. So those ligaments cause huge amounts of pain, and if you've got a big lordosis, they're in a lot of danger. And of course, everything in the low back will be in danger. So you said a big lordosis. What was the other? A flat back?
Yeah.
Yes, flat back has a lot of dangers too, because you don't have the natural shock absorbing. When you have the lordosis in the low back and in the neck, and you have the slight kyphotic curve in the thorax and also in the sacrum, that's a balance that has kind of a spring reaction to it. And if you don't have that spring, you're going to send a lot of shock waves down into the sacrum. So I'd say if you have a reverse curve in your low back, you're going to put a lot of pressure in the sacrum, and that's going to be the danger zone for your body. You also might get it, up higher in your iliolumbar ligaments. If you put your hands on your hips, like just your hands on your hips like this, whatever, and your thumbs are on the top of your ilium, that's about where the iliolumbar ligaments are. They go from the anterior medial aspect of the ilium, about an inch or so lateral to the ASIS, and they go over and attach to the transverse process of the fifth lumbar vertebra. Sometimes they also go to the fourth, but the place they get injured is right at the attachment to the ilium, and it causes pain right across the low back, right on top of the ilium, straight across one side of the low back. They also give pain into the outer part of the hip, into the tensor fascial muscle area, also into the groin, and even into the genital, the labia of the woman and the testicle of the man. People will come in, and I remember a woman, she was holding some groceries, and just holding the groceries, she had this pain in the vaginal area, and she'd been to the gynecologist, didn't know what was going on there. And so what she had was an iliolumbar ligament that was strained, that was referring pain into the groin and the genital area. And as soon as I touched it, she felt the pain right there. And so we knew that's what we had. And no one ever thought to look at that, because most people are not trained in that sort of information. But the more knowledge you have, the better you're going to be able to help your client. Just a couple of years ago, I redid my Listen to Your Pain book, and I put in 116 extra drawings by my wonderful friend Norman, the artist, and I made a separate section just for therapists at the back with 80 pages. You can look on 3 pages and you can see the anatomy, the tests you do for that particular injury in the low back, the neck, the shoulder, the ankle, the knee, etc., and what's the friction, what is the treatment for it, and how you do it with some illustrations. And also exercise programs that the person can do to help themselves. So I'd say that's a great resource for people to have that's really quick, just like that. Another resource is all the webinars that are on my website, on the low back, on the neck, on the shoulder, on the knee, on the ankle, and soon we're going to be doing one on the hip and thigh. You just got one webinar will teach you how to do the treatment and how to do the assessment for the sacroiliac, another one for the iliolumbar ligament, another one for the sacrotuberous ligaments, etc. So it's very targeted training. You just spend an hour or so. You also get some videos you can watch, and you can figure out. And I didn't think this would work actually in the beginning, but then I did these DVDs that I did, very, very detailed, extensive DVDs on the neck, low back, knee, etc. And then I saw people buy them, and then they came to see me to check if they got it right. And I was amazed at how right they got it from just watching a DVD.
Wow.
Now, a beginner can't do that. You have to be a very accomplished, experienced therapist. But if you're an experienced therapist, you can watch a DVD and figure it out. It's not rocket science here. So So I think that these webinars, DVDs, etc., are really helping therapists to be much more skilled at much better cost that they can do on their own time, anytime, in their own home, in their own office. So that's another resource to help people figure these things out.
And that's awesome. And then back in the mid '90s, when I was in massage school, we were always told that tight hamstrings equal low back pain and stuff.
Well, that's partly true. If you've got a tight hamstring, let's say you lie on your back on the table and you lift the person's leg with the knee straight. Now, if the hamstring is healthy, your back is not going to start to cave and go toward the floor until you reach 80 or 90 degrees. But if your hamstrings are really tight, when you hit 45 or 50 degrees, your back goes. So that means that all this weight and all this stuff is going into your low back because you don't have enough flexibility in your hamstrings. So huge amounts of pressure are put on the low back when the hamstrings are not working right. Now the hamstrings, are supposed to be in balance with the quadriceps, and the gluteus maximus is in balance with the psoas muscle. So if your psoas muscle is very activated, meaning you're kind of forward, you're kind of leaning forward a lot in your body and slumped, as many people are, and what happens is what we call the neural signals that go to the gluteus are very diminished. And what happens is they don't function very well. And then the hamstrings try to take over to do a job they can't really do very well. That contributes to the hamstrings getting tighter and having to work hard and getting them strained. And they can't really do the job to protect the back. So it's a complex situation, and both the hamstrings and the quadriceps, if they're not flexible and if they're not strong, you have a greater chance of hurting your back and hurting it continually. So that, I think, is a true thing you learn. And there's a huge amount more information about that these days that you can get.
Okay. And then what about stress? I mean, so many people are stressed nowadays. Can that lead to lower back pains or other kind of pains a lot, would you say?
Absolutely. We live in an incredibly stressful world. There are other parts of the world that are even more stressed. They don't even know if they're going to eat tomorrow or if they're going to be alive tomorrow. But here in the West, in the United States, in Europe, and in parts of Asia, where people have some leisure, they're under tremendous stress. People don't know how to take time to recover. You need to recover. You can't be kind of going on nervous energy all the time. And what happens is the sympathetic nervous system gets activated all the time. And so your adrenal glands get, really worn out, and your body is not functioning very well. So stress, let's say you get stressed. What do you do when you're stressed? Well, you don't sleep very well. And if you're not sleeping very well, your body isn't repairing itself. And then if you're not repairing yourself and you're tired, what are you going to want? You're going to want to eat sugar. You're going to want to eat a lot of pasta. You're going to want to eat things to give you kind of a quick energy. And soft drinks, alcohol, whatever. And so that's going to make you much, much more unhealthy. Sugar should be eaten, maybe 3 times a year. Your birthday, Christmas, and Thanksgiving. That's it. Eat sugar every single day. It's in everything. It's the most unhealthy food. It's not even a food. It's this chemical that they're making in the form of corn syrup that's making everybody overweight and unhealthy and making your body completely break down. So that adds to your stress, even though you're using it to be having less stress. And then what people do is they go and they do some aerobics, and they go into the gym or they're running, and they're breaking their knees and they're hurting their body because they're exercising too much to get rid of the stress. So there are many things that we do in our life that could make us less stressed, like we could have a massage every week. Everybody should do that, I think, in this crazy world. We could exercise, we could do yoga, we can meditate, we can be with our family, we can watch TV, relax, enjoy life, take vacations. Most people don't have that as a regular part of their life. In my first book, Are You Tense?, I said, you have to take a vacation at least 2 weeks a year. Should be maybe 4 or 5, but at least 2. And I have people who call me up and I say, I show my book to my husband, your book to my husband. We go on a vacation every year now. You've got to rest and recover. We need recovery in order to function well. And many, many people don't do that. And then you've got people who have their emotional upheaval. They don't know how to communicate. They don't know how to be in their own body. And so that's another reason. So people often don't need massage. They don't need injury treatment. They need an injury to their soul, to their heart. They need some therapeutic intervention of another kind that's equally important and is often ignored and thought of as sort of strange by lots of people. So sometimes you need some kind of therapy in order to increase your functioning, to de-stress yourself. So whatever it is, exercise, eating better, doing yoga, stretching, relaxing with a book, whatever it is, that should be an important part of people's life so that they have a balance in their life. And stress is definitely a major cause of all sorts of internal organ problems, headaches, sleeplessness, injury, you name it, stress is a part of it.
Awesome. And then what about low back vulnerability? Why is it so vulnerable to injuries all the time?
Well, there are lots of different reasons. Well, one reason, let's take women for example. When a woman has a child, what happens is the ligaments of the entire body loosen up, because especially in the pelvis, you get all these loosened ligaments to make room for the child to come out easily. And so then you've got loose ligaments. And when your ligaments are loose, you are incredibly vulnerable to injury. Now, you could be a man or a woman, and you are very, very flexible. You know that person who, when you were young, they could put their foot over their head or their toes in their mouth, and we call them double jointed. Well, they didn't have two joints. What they did have was long ligaments that were too long for their body. And so they were excessively flexible. And that's what happens to almost every woman who has a child. They get very flexible. I mean, I have a good friend who's a trainer, a therapist, and her body was perfect until she had a child. Well, then she started having back pain and neck pain, because all the ligaments started loosening up. And so that's one of the dangers of the low back. Also, we've not been standing on our two legs very long. If you crawled around on your hands and your feet, your back would be a lot safer. I don't think that orangutans and monkeys and gorillas have that much back pain. They might, from fighting maybe, but not too much. And I think in the evolution of the human species, we've been in an upright position for not all that long historically. And so there are many reasons. We've got our stress. We've got the fact that we don't really exercise. We used to have to spend most of our day looking for food, running after animals, killing animals to eat, getting grubs out of the ground, traveling, walking, climbing trees. So everybody was pretty strong consistently. Now we exercise, once a week, or on the weekend we play volleyball and kill ourselves, and the rest of the week we don't do anything. We sit in front of a computer. So it's very uneven. So we're very vulnerable for many, many, many different reasons. Too many to even go into. That's a few of my thoughts.
And then why, for so many years, I mean, way back in the day, people would have wallets, and they never really correlated with lower back pain sometimes with the wallets. And
the walletectomy kind of thing?
Yeah.
So, and if you're sitting on your wallet, you're going to have an imbalance in your low back. I don't think that's as big a thing as they thought it was. But certainly if you're sitting lopsided, it's going to affect you. But there must have been many other factors that have affected it. There's one other factor, and that's how happy you are in your life. If you're not very happy in your life, you're going to be very tense in your body. You're going to be stressed in your body. If you're not having a normal sexual life, you're going to have all sorts of tension in the pelvic region, in the abdomen, in the back, in the whole pelvic region. So all of these things play together. It's not a wallet, it's not exercise, it's not one thing, it's everything together. But maybe one of the most important things is having a life that's fulfilling, having a life that you enjoy, that you make time to be with the people you love, to relax. That's what makes your body healthy.
And then let's say somebody has lower back pains and they have an appointment, but it's like tomorrow or the next day. What can they do to ease that lower back pain until they get in for an appointment?
Well, it's pretty hard to tell them that before you see them. If, for instance, remember we talked before about a flexion pain. Well, if you're going to have pain when you're in a flex position, so I would say to a person, if you have pain sitting, don't sit. If you're really comfortable lying down, get a chaise lounge. I have a client who's a psychiatrist, and I said, bring in a very cheap, chaise lounge you take to the beach and see your patients that way. She was trying to sit in a chair. It was killing her. So get into a position that doesn't hurt you. Or if it hurts you to sit at all, do your work standing. If you're on the phone, if you're on a computer, Put a couple of boxes on your desk. Put it on top so that you can do your work standing up. Find the position. There's no formula. There's no trick. There's no magic trick to it. Just find the place or the position you can be in that you can be most comfortable, and get in that position. And don't stay still. Move. And let your body move. Like a lot of people say, it feels good to stretch. I say, hey, stretch throughout the entire day. Get up, walk around. Do what you have to do to make your body comfortable.
And what about heat or cold?
Well, everybody's a little different. If you've got something that's swollen and inflamed, you're not going to put heat on it. But in the back in general, if you put like a hydrocollator on your back, that's nice, a heating pad. I use infrared heat with people, and some people do a lot better with ice. I've got these cold pack, these huge ice packs that are this big, and I have people just lie on them, and that does them really great too. Or you can have these things that you can heat up in the microwave or in the oven and just put it something that's very warm. You have to do what works for you. Again, there's no formula. Some people, cold makes their body constrict and contract, but heat makes them relax. Other people, it's the reverse. Cold does it great, but heat just kind of makes them nauseous. So you work on an individual level with each and every person.
And then what resources would you recommend for learning more about treating lower back pain?
Well, there are probably lots of them. Let's start with the ones that I offer. I offer my book as a good resource. My DVDs are a good resource. My webinars are a good resource. Tom Meyer's work, we've just been doing some work with him on some webinars. Doing some structural integration work would be excellent for people's backs. If you work with an osteopath to create balance in your body, that's good. And chiropractors do so many different things, I'm hesitant to recommend it as a branch of healthcare because it's so individualized, but sometimes there'll be a great chiropractor that'll help the person. Not to see them every week or forever, but to get them aligned and let them go. Other resources are people who really know about the body in terms of how do you get your body aligned and healthy and strong and flexible. Lots of therapists have been calling me and writing to me after I wrote an article about integrating personal training and fitness into their massage practice. There's a group called Go Primal Fitness that's in Gainesville, Florida, that does a course that's really aimed at massage therapists. They also teach trainers, but it's really aimed at therapists to give them the skills they need to not only get somebody better in terms of, feeling better, let's say after their massage, whatever skills they have around assessment and treatment, but then what do you do with them afterwards? How do you get somebody to be really healthy? So I think some training in functional assessment and functional exercise would be another great resource for people. Now, I'm sure there are many more. I'm leaving tons of things out. Nutrition, working with a good nutritionist, all sorts of things. So those are the ones that come to mind right away.
So your webinars, how long are they usually, and what kind of webinars do you offer?
Well, the webinars are usually an hour long, sometimes an hour and a quarter, but then there are usually ancillary video clips. Like, for instance, if you do one on the sacroiliac ligament is the major cause of pain in the low back, so you'd learn all about that, the anatomy, how to assess it, how to treat it, and then you would get a little video clip that you could watch over and over again when your client's even on the table, to learn how to do the treatment on that, or the psoas, or whatever it is. So each one of the webinars is about an hour long and covers one particular part. Another one, the iliolumbar ligament, another one on the sacrotuberous ligament, etc. Then we do some clinical seminars where we help you think about it and how to figure out what's really wrong with somebody once you get information on the history. We also spend some time teaching you how to take a history and what does that history mean. We do the same thing for the neck. Various different injuries in the neck. The same thing, there are 23 different injuries in the knee, and I cover most of them in a series of 7 webinars. And we have the major ankle injuries that we cover in 4 webinars, and the shoulder injuries we cover in 5 webinars, frozen shoulder, supraspinatus, infraspinatus, subscapularis, all these different, very discrete injuries. And so those are, people have been using those all around the world, actually, and getting tremendous feedback on how useful they are. And they're pretty inexpensive. You don't have to leave your house. You just order it. It comes right to you in a couple hours or a day, and you just can keep it for a month and do it.
And do you offer continuing education credits too?
Oh, yeah. each one of the webinars has, like the low back, I think is 9 credits, and the neck is 7 credits, and there's somewhere between 5 and 10 credits for each of the webinars. We also offer credits for Tom Myers Anatomy Trains and Tracy Walton's Cancer in Massage. So always this continuing education, and I'm also travel around the country. I'll be in Minneapolis at the Centerpoint School doing a workshop on the neck sometime soon. I think in June 25th, 26th. I think. Then I'll be in New Mexico doing an active isolated stretching thing. I'll be at the Massage Festival in July in North Carolina. I'll be again in North Carolina at the BTI school. So we'll be traveling around, and then we got a great trip going down to Costa Rica on New Year's Day. We start doing active isolated stretching for the low back, the trunk, the legs, the feet, and then I'm going to do one with Tom Myers on the neck and neck pain and the structure of the neck, and he and I are going to team up and do a course in the middle of February in Costa Rica at a place called Pura Vida, beautiful retreat center.
And why Costa Rica?
Well, why not Costa Rica? Water is good.
Yeah.
So I went down there because Eric Dalton recommended the place to me, and I went down and I looked at a bunch of places, and I came to the place he recommended, and I said, "Oh my God, this is an incredible place. It's beautiful. It's cool in the evenings. It's warm in the day. There's beautiful sunshine. The food is phenomenally, just fantastic. The spaces you teach in are wonderful. There's body workers from all over the world that are there that give great treatments. It's an incredible environment to learn. There are trips, there are all sorts of things every day, and it was just a wonderful learning environment. And I had a great time, and I hope to go back over and over and over again. I'm with Eric."
Okay. And then with somebody asks, where's the best place to get your DVDs then? Would it be your website then, or?
Yeah, just go to benbenjamin.com. You can't miss it. You can't. It's very easy. Just go to benbenjamin.com and boom, and you can do it on the internet. You can call if you don't like the internet. Just call us up. We ship it out the next day.
And then those also with continuing education too, with the DVDs.
Absolutely. Yeah. Well, the DVDs, you get 35 continuing education credits because it's got hours and hours and hours of stuff, and then you've got to practice for hours and hours to really get stuff down. So it's a very extensive and thorough, detailed. We do a whole DVD on the anatomy, not just learning it, but we have you palpate every structure, and we do all the assessments on a whole other disc, and every single test, and all the history questions, what everything means, the theory, all the treatments, myofascial, massage treatment, friction therapy, exercise therapy, etc. So it's very extensive, and people spend a lot of time on it and get a lot out of it. I've got nothing but great feedback from people on it.
And then and then you're also a life coach too, then, right?
I coach people. I've been coaching people for about 30 years or so in their work, and I also coach people on how to have a life that they love and doing work that they love. My motto is work smarter, not harder, and I've been doing that with people for a long time. So I'm venturing into a new kind of world right now where I'm going to be teaching communication skills, hopefully around the world. I have a book coming out called Conversation Transformation. It's really a book about how to change how you interact with yourself and with others, and how do you learn the skills to communicate really, really well in your work and in your life. So that's going to be my new adventure.
And it seems so many people have a hard time communicating now because we're all online all the time, or we're always on Facebook, and that face-to-face interaction is getting less and less, it seems.
Yeah, that's true. And most people think they communicate just fine. They think it's the other guy that doesn't communicate very well. And it's usually both people who are not communicating very well. You start out a conversation and it feels just fine, and then all of a sudden you feel kind of funny in your gut, and you're upset with the person, or you feel hurt or angry or irritated, and you don't really know why, and you don't know really what to do with it. And these are, in this book and in this training that we do, we teach people how to work with those issues and how to communicate better. I just came back from Seattle where we did a 4-day training for massage therapists on how to communicate better, how to use that in their business, how to make their business work better, how to help their clients more. And we had a grand old time.
And then Phyllis in the chat asked, are you actually going to be retiring anytime soon, or are you going to keep on going?
No, I'm going to retire when I'm dead.
Okay.
and then I won't do any more work. I actually like to work. What I say about work is that it beats working for a living, because I love everything that I do. So, I mean, I do it because I like to do it, and oftentimes I've taken a year off from work and done absolutely nothing except play drums or study something. And I've had other years where I've worked 90 hours a week. I don't work that hard anymore, but I get a lot of other people to work, and I have a great time, and it's fun to work with the wonderful people that I have around me that I work with to create new opportunities for learning. And it's just an enjoyable thing. So I think I'm going to be teaching forever. I may not be teaching the body work things forever, but I'll probably be teaching the communications things forever. And who knows, I might do both forever.
and then what other kind of suggestions can you give? Can you recommend a massage therapist to tell to a client to do for home treatment for lower back problems?
Well, what I do is I would teach them, when I'm doing my active isolated stretching with them, I would teach them, I use a rope or a strap to teach them how to stretch their hamstrings, their quadriceps, their adductors, their abductors, their calves, and then I would teach them how to stretch their back. And that's what I would do for homework for them. Then I would start to teach them things to do to strengthen their back, like squats. And doing a squat is not an easy thing to do. You've got to really know how to do it. Feet flat on the floor, parallel, shoulder width apart, back sort of straight, go all the way down, come all the way up. Then you start doing it with weight. You start doing it with 5 pounds, 10 pounds, 20 pounds, 30 pounds, 40 pounds, 50 pounds. You want to be able to do 10, 12 squats easily, especially with 25 pounds. And you want to get the body flexible, and you want to get the body strong. And so I teach people how to do that themselves. First, I do it with them, and then I transfer it over to them so they don't need me. They can just do it themselves. And if they're smart, they'll come in for an active isolated stretching session once in a while, and certainly get a massage every week or every other week. Not necessarily from me, but from somebody to keep their body relaxed. It's like taking a vacation in the middle of the day.
Okay. And is there any other suggestions at all for lower back pain that you can recommend the viewers now?
Well, I think we've gone over most things. Let's see. I've got one other little technique that I use, and that's using a lacrosse ball. You lie on a rug or something, or a bed if it's too painful, and you take a lacrosse ball, you put it under your buttock, under your hip, you bend your knee, and you let your knee fall out, and you really have a pressure that's happening into the buttock area, and you move it around to different spots, leaving it there for 20, 30 seconds in each space, and to just get the whole pelvic region to relax. That's another thing that's easy for people to do.
Okay.
Okay, I think we've said it all.
Yeah. So the best way to get a hold of you would be benbenjamin.com then?
That's at my website, or they can just look me up. I'm in Cambridge, Massachusetts. I'm listed 617-576-0777. I'm the easiest guy to find on the internet. I come up on the first page. My website is easy to do. You can call us, you can write us. We're happy to help you.
Okay, thank you very much tonight, Ben. My brain is definitely full now.
All right. Everybody.
Yep.
Bye-bye.
Yep, thanks.